It's more or less the same as the normal ICU patient. That's my impression. But we also installed an additional trend graphs. So we created special trend pages in order to have a big overview, a great overview for the patients, not only for the normal parameters, for hemodynamics and ventilation and infection and liver and kidney function, all these things. But also we included specific sections for COVID parameters like ferritin, LDH, eosinophils, and also we included the view in the trends of patients being prone or being on ECMO. So that was something we previously did not include it into the trend pages, but we included it from the start of the COVID pandemic in order to have a big, nice overview of which patient was prone and then additionally on ECMO and then afterwards weaned from the ventilation. So we had a big overview, a great overview on these patients because we are on duty for all these patients with one or two at maximum senior staff members at night or at the weekend. So if you have 40, 50 patients or more on ventilation, it's impossible to have a great overview of these patients if you don't have digital solutions. Most of my colleagues agree that working for COVID patients was more stable than working for the most critically ill patients. Because they were used to working with a system that was nothing different than before. And COVID patients are very similar in their clinical course. They are difficult to ventilate. They get prone ventilation, some get ECMO ventilation, but it's mostly a ventilation problem and a sedation problem. Some of them have also kidney problems, but we didn't see that very often. But that's the main course in these COVID patients. And because we were used to working with the digital system, we didn't have extra burden on working with these new kind of patients. So we had all the time and the possibilities to focus on the treatment of the patient and not on being able to have an overview of these patients, because we were used to the system as well. I would advise these hospitals to start a transition to digitally as soon as possible. It is my real conviction that using digital solution for the ICU is the best way to improve the quality of care of your ICU patients. If you don't use digital solutions for your ICU, you don't have the broad overview that you need to treat those patients the best you can.